Hello and welcome to this Dual Energy KUB training video specifically to the Siemens Somatom Force and the Singovia Dual Energy workflows. In this session, we'll work through when and why we perform Dual Energy KUBs, how to acquire them correctly, and finally, how to perform the post-processing and stone characterization on Singovia. Dual Energy KUB imaging is primarily used for detection and differentiation of urinary tract stones. This differentiation is clinically important because different stones require different treatment pathways. Around 80% of urinary calculi are calcific, while 8 to 10% are uric acid stones. Uric acid stones respond well to medical dissolution therapy rather than requiring surgical intervention. By identifying stone composition up front, we can guide urologists towards the most appropriate treatment and avoid unnecessary surgeries. Alright, here we're actually going to go through scanning. So first we start with a standard KUB scanning. So we open our KUB, we load, and we perform our topogram. Once our topogram's performed, we set up our standard monoenergetic KUB scan. We load and scan. Once our scan is performed, we scroll through and review our images and we assess for the presence of any stones. If a stone is identified and composition analysis is relevant, we proceed to do a targeted dual energy KUB over the region of interest. By doing this two-step method, it limits unnecessary dose while still capturing the dual energy data when required. So now let's walk through the dual energy part. So we're going to go to our list and select our dual energy KUB protocol on the scanner. We're going to scroll through until we locate our scan. Using the little pink box here, we can snap our scan start to the exact slice on our images. For this one, there are a couple of stones within the kidneys, so we scanned the whole kidneys. We load and we perform our dual energy scan. So you might be wondering, why do we do two scans? The reason is dose. So let's have a look at this example. So our first single energy scan gave us a dose of 191 milligray. Now, the dual energy gave us a dose of 148 milligray, giving a total of 339 milligray for the patient. So, what if we performed the whole scan as dual energy? Let's go and repeat and scan the whole region and see what this gives us. Here, we're looking at a dose of 369 milligray. So, by doing the two scans, we still only gave our patient 339 milligray. Importantly though, patients who do not need the dual energy data receive less than half the radiation that they would if we did every patient with a dual energy KUB. Okay, now we've performed our dual energy scan. We need to perform our Singovia workup to actually get the results from the data. So, let's go through how to do that. First, find your patient on Singovia, select Open With, and CT Dual Energy. Give this some time to load. It can take a little while, but hopefully with the power of editing, this one will be up in any second. Okay, from our DE presets, we're going to hit kidney stones. We're going to navigate down to our kidney stones navigator and select Next. This is going to move through any potential stones that the scanner highlights. If we can confirm that this is a stone, we hit Set Marker. As you can see here, we're navigating through all of the stones in this patient scan. Now this time, it's picked up a little bit of rib potentially, a bit of bone on the side here. We're not going to hit Set Marker on that, but we keep navigating through to make sure we've captured all of the stones that it's highlighted. We can check these in the coronal or the sagittal planes to see what it is picking up. Once it has done all of this, it's going to start plotting our stones over on this little chart. As you can see, we've got this white line across here. Everything above this is a calcific stone. Everything below this is a uric acid stone. Once we've done this, the scanner will create some automatic results. One of these will be the picture you see on the screen here. Now, this is interesting because it actually shows us the Hounsfield units at a mixed kV, the 100 kV, and the tin 150 kV. So this here is showing us the exact attenuation profile and how it's used that photoelectric effect to determine what material this particular voxel is made out of. Once we've checked through and we're happy with the results, we hit Save and Send to send them to PACS. So as we mentioned in the first video and a little earlier, Dual Energy scans the material at 2 different kV. In this case, we've got 100 kV and tin 150 kV. So this graph is actually showing us the Hounsfield units of each stone at each kV level. So that is how it uses these graphs to plot those materials. So this here is an example of that material decomposition algorithm in a clinical application. Okay, that's the end of the Dual Energy KUB video. Hopefully it stepped you through how to perform these scans and the workups, but also gave you a good clinical grounding in the theories that we discussed in part 1. So those 2 kVs, the dose penalties, and some examples of how that can be used in the real world. Thank you.